All right. Good afternoon, everyone. Welcome to the June meeting of the Kentucky Judicial Commission on Mental Health. Thanks to everyone for coming today. I want to thank you for your continued commitment to the commission. I'm truly inspired by the energy, collaboration, and innovation happening by all of our committees and work groups. Looking forward to hearing today's updates, learning more about the positive impact being made in our communities. In your materials today, you'll find a copy of today's agenda and the meeting minutes from the March meeting, and you need to add that to your binder. Do I have a motion to approve those March minutes?
Motion to approve.
Second?
Second.
All right. Motion passes. I assume nobody objects, do they? All right.
If you're going to word it like that.
This is not a democracy. All right, you'll see in your materials, we have a new Supreme Court order appointing new folks to the commission. It's important to us that we always have the right people at the table to help us with this work. So I'd like to welcome our new members, Jaden Norris. Jaden's here from the NAMI, Kentucky. Of course, we introduced Jaden at the last commission meeting, but I'm happy to announce that she is now a full-fledged official member. Welcome back, Jaden. Next, we have Tanya Terry. Tanya is the Montgomery County Circuit Court Clerk and recently was elected to serve as president of the Kentucky Circuit Court Clerks. Tanya is replacing our good friend, Margaret Forsey. Margaret, thank you for spending the last year with us. You're always welcome here. And Tanya, we're welcome to have you and look forward to helping you or helping us with the clerks. We have Johnny Bivens. Johnny is the Lewis County Sheriff, and he is the Vice President for the Kentucky Sheriff's Association. Having law enforcement as part of these efforts is critical. We thank you, Johnny, and your willingness to join the commission. And as a side note, Johnny and I spent a lot of years together because he's the Lewis County Sheriff, and that was in my circuit. Dan Mosley. Where's Dan? Is he here today? He's not here. Dan's in his third term as the Harlan County Judge Executive, and he's the president of the Kentucky Association of Counties. Dan's replacing David Livingston from Scott County. And Dan believes also that collaboration and working together is how we make Kentucky stronger. I believe that the commission's work is a true reflection of that. Welcome you, Dan. I hope you're on the screen. Lastly, we're welcoming Dr. Stephen Stack as the incoming Secretary for the Cabinet for Family Services. There he is, right there. Yay! Dr. Stack's bringing to the cabinet a 20-year medical career, including his work as the commissioner for the Kentucky Department of Public Health and chief medical officer of the Commonwealth of Kentucky. Behavioral health is mental health. We're excited to have you to join us, Dr. Stack. And he is also going to be on the executive committee. So thank you for be willing to serve that. Dr. Stack is replacing our friend and colleague, Secretary Eric Freelander, who'll retire August 1st. I'd like to take a moment to express our deepest thanks to Secretary Freelander for his tireless leadership and collaboration on behalf of the health and well-being of Kentuckians and the Kentucky communities.
I think that needs a standing ovation.
I think so too. Secretary Freelander has devoted 40 years of service to improving the lives of Kentuckians. And during his tenure, he played a critical role in implementing the Affordable Care Act in Kentucky, expanding Medicaid coverage, and advancing access to behavioral health services. He also guided the state's COVID-19 response with compassion and resilience. helping CHFS become the light when folks face challenges. Under his leadership, the cabinet secured grants such as the $7 million behavioral health grant to support disaster-affected communities in eastern Kentucky, and Lord knows we've had many of those. From his work as the Louisville Chief Resiliency Officer to his decades of service across CHFS departments, Secretary Freelander has embodied the Commission's values of compassion, collaboration, and innovation. But beyond those accolades and accomplishment, what has mattered most is his willingness to sit at our table, meet with our members, and champion our mission. He's opened doors, helping us to develop programs, train judicial officers, and forge partnerships that continue to grow every day. Secretary Freelander, on behalf of the Kentucky Judicial Commission, thank you for your unwavering commitment. Thank you again. Okay, community mapping. This quarter, the Kentucky Judicial Commission on Mental Health continued to expand its community mapping initiative, completing new mapping sessions in Webster, Union, Crittenden, and Bullitt counties. These sessions brought together local leaders, judges, treatment providers, and justice system partners to identify gaps in behavioral health services and build stronger, more collaborative responses to individuals in crisis. With the addition of these 4 counties, we now have 11 counties since the initiative began. Each mapping session serves as a powerful tool to align local efforts to enhance communications across systems, support more efficient and effective court-based interventions. You'll find community mapping update in your materials, with plans to go to Lincoln and Clark County next. Senate Bill 26, I'm sure you've all have heard that by now. The 2025 legislation, SB 26, passed unanimously and was signed by the governor on March 18th, just a couple of weeks after our last meeting. The bill, focusing on parental rights and disabilities, included key elements that established a precise definition of disability within KRS 199-011 to ensure uniformity and consistency in decision-making. It also amended KRS 199-471 to prohibit the denial of adoption or child placement petitions based solely on an applicant's disability. It also required a thorough review process for placement decisions involving disability considerations, with a documentation maintained for transparency. And lastly, it updated KRS 625-050 and KRS 625-090 to ensure parental rights are not terminated based solely on disability, while encouraging courts to consider reasonable accommodations and supports tailored to individual needs. We want to thank and congratulate Crystal Adams, Judge Vanover, and Senator Brandon Storm for their efforts on Senate Bill 26. With this, the commission has now had 2 successful legislative years. The bill will become effective on June 27th. The Executive Committee also met last week to review all legislative recommendations from the workshops for 2026. Next year's efforts will focus on improvements to 202C process for individuals adjudicated incompetent to stand trial who've been charged with qualifying serious offenses. We'll keep everyone posted on this in the upcoming months. So today, it's my pleasure to introduce today's presenters from the Department for Behavioral Health, Developmental, and Intellectual Disabilities to talk about their strategic initiatives. And with that, we have Commissioner Katie Marks and Executive Advisor Dr. David Sussman.
Good afternoon. Perfect. It's a pleasure to present today to share some of the initiatives we're working on in our Department for Behavioral Health, Developmental, and Intellectual Disabilities. We could take all day, all evening, and into next week to talk about everything that's happening in the department, and happy to do that if it's at your pleasure. But what we decided to do was narrow the focus a little bit to some of the things that we are working on right now that are directly intersecting with the Judicial Commission, and to also think about where we're going in the future and to drum up some excitement about that. It's a pleasure to present with Dr. Sussman today. We're going to share the floor in exploring the breadth of our work and also suggesting a few opportunities that we have for additional collaboration into the future. Perfect. Our department's name has a comma in it. It's so long, thanks to someone we've got in this room. Department for Behavioral Health, Developmental, and Intellectual Disabilities. And we say that name in its entirety every time because it's important to remember all of the different domains that we're working in. And I think this visualization helps to communicate that. We have the facilities that we operate or partner with community partners to operate. We oversee mental health, substance use disorder, developmental and intellectual disabilities, and also our Office of Autism. In addition to that, we oversee licensure for alcohol and other drug entities. We do data analytics, quality monitoring, and then our administration and financial management. But all of that comes together to create a really clear mission, and that's to promote the health and well-being and resilience for all, to facilitate a recovery for people affected by mental illness and substance use, and to support people with intellectual and developmental disabilities. And we take all of that and we say we have three priorities. These are our North Stars, that we increase access to services, but not just access to services, but the quality of those services. And that as we do that, we build an inclusive, resilient workforce. I share that because I want us to not be a best kept secret. I share this array of services because sometimes the work gets lost. And our responsibility, our opportunity is transparency and communication about all of the different ways that we're intersecting with your work every day. And so pay attention as we speak to ways that we could be partnering more closely, or to a brief note that I made about a program that we have that you could be joining us to participate in. We wanted to start with a quick overview of some of the highlights of our annual report that came out last year. This is on our website, and we can send out a link later to allow you to scroll through the entire piece. But what is really impressive is the breadth of work that's happening and the breadth of impact across our state. Almost 150,000 distinct Kentuckians were served on the mental health, the substance use side, or the IDD side through our community mental health center partners. Nearly 7,300 individuals were also served through our residential facilities. That's tremendous impact as our behavioral health safety net. And we saw really positive change. We've got meaningful outcomes that we can communicate. A 27% increase in utilization of 988, our crisis and suicide response hotline. At the same time, we're seeing positive trends that we've been all working for so long in overdose reductions. This is the 2024 report, which was 9.8%. But as you'll see later, we know that this was the 2024 report that had 23 data in it. We know that we saw even greater reductions the year later. In our crisis response space, wow, we're seeing 150,000 calls and texts and chat every year to this number. That's through our community mental health center crisis lines. That's a remarkable capacity that we now have, because when we're able to answer the phone and talk to someone in real time, that means that almost 98% of the time, we don't need to move further in the crisis response process. We don't have to move to mobile crisis or outreach or bringing them into our centers. And so that's a tremendous prevention and early intervention engagement point. Moving beyond crisis, our services and supports for adult mental health aren't just what you think about. They're not just behavioral health services. They're the wraparound services and supports that make such a difference in individuals' lives. And so you'll see here on the screen, and I won't point out all of the details, but we work really hard on housing and community supports, bringing peer support to individuals, doing outreach and engagement, case management, and then linkage to behavioral health services. We also do a lot in in-reach to personal care homes, hospitals, shelters, jails, and prisons. And I always want to highlight our Assertive Community Treatment, or ACT team, which has served over 660 people just in a year. In the forensic space, this is where we so closely intersect. I'm just really grateful for the partners in this room and across the state that are contributing to a really broad umbrella of forensic services. And this annual report really reflects the volume and diversity of work that we support. And everyone's coming together around a common value, which is centering rights, dignity, and access to evidence-based practices in all that we do. Forensics is also a priority of our strategic action plan. We sat down a year ago and we said, of all the things that we're doing, what does the community need most from us? What is the most urgent priority? And forensic services rose to the absolute top of that list. But what I really wanted to spend time with you today talking about is a new initiative that's coming out, and it's called RISE, Recovery, Independence, Support, and Engagement. We've been talking about this for about a year, and what it is it's a new state plan amendment that's launching July 1 of this year for individuals with serious mental illness, SMI, and SUD to finally bring services and supports into the community that have been all of our missing pieces. It aligns with all of our goals of decreasing hospitalization, decreasing incarceration rates. It's going to bring the services and supports in the housing space, in the case management, in the transportation that we all keep naming as the missing piece. And so, as I said, this launches July 1, and we're going to begin to enroll providers. But September 1 of this year, individuals who are 18 years or older, who are eligible or enrolled in Medicaid, who are diagnosed with a serious mental illness, who may or may not also have a substance use disorder, who are facing daily challenges in their functioning, whether that be housing or work or engagement in employment, are going to have the opportunity to join and participate in these services and supports. And I'm missing a slide, but that's okay because these are well memorized. There's 10 services that are going to be available finally for Kentuckians. Most importantly, in the housing space, we're going to have what we call residential, 3-person staffed residential homes that individuals can transition to. This is based in the community. This is that gap between leaving an institution and living independently in the community where they can be together with 24-hour supervision, behavioral health services, and supports so that they can be in community in meaningful ways. If they don't need that level of intensity of supports, independent living supports are going to be available. We've got folks that are going to be able to go into individuals' homes daily for hours a day and provide the services and supports they need. If they're having trouble getting into housing, for the first time in Kentucky, we're going to be able to use Medicaid funds to support tenancy supports, getting into housing and staying in housing. This is going to dramatically open up the network of providers that are able to sustain their work and intersect with what we're doing in Kentucky. Assistive technology, this is starting to go deep. This is going into what are the physical barriers that people experience that make the difference between engaging in community or experiencing isolation, an increase in their symptoms, and possibly return to one of our institutions. And so this could be as simple as technology on one's phone or physical tools that help people interface with the environment. Medication management, someone that can come into the home every day if needed to help with medication planning and taking, or just consultation. Non-medical transportation, this is the big one, right? We know that people's lives, their Their ability to connect with community and to achieve fulfillment is contingent upon being able to interact in the community. And that means transportation for everyone. And so the ability to drive folks, not just to their medical appointments, but to community engagement events that are part of their care plan will be transformative for folks. Supported of employment and education are also part of this. We know that these individuals need a little bit more than we can currently give them. And as part of that plan, they'll have access to it finally. So my ask for this group is to help us promote awareness. We have a website that launches on the 15th of this month that is going to have all of this information and helpful trainings. But the first piece that we need are providers to come on board. And so when you hear these array of services and supports and you think about who's in your community, and it just doesn't have to be a traditional behavioral health provider, it can be nearly anyone that might be interested in enrolling in Medicaid and becoming a service provider, let us know. We'll connect with them personally. The success of this program is contingent upon building this new network. I'll mention briefly, I want to move through some work that we're doing with serious mental illness and substance use disorder and their co-occurring nature, but I can't not, my past in Kentucky overdose response effort, not talk about our reduction in overdose deaths. Over the years now, we have a true trend line beginning in 2022 and moving through 2024. I know you know this, but if we don't celebrate every chance we get a 30% reduction in overdose deaths, then we're missing an opportunity to maintain that momentum. And so I just want to highlight this if you haven't seen this graph. What we are doing is working. Treatment access, linkage to evidence-based practices, medications for opioid use disorder, access to harm reduction resources like naloxone and fentanyl test strips, recovery community centers, vibrant spaces where people can come together to join forces and advocate for each other. That is what's making a difference in Kentucky. Move through this a little quickly because we got a lot. The last thing that I want to share with you, and I'll turn it over to Dr. Sussman, is a really big initiative that we're going to launch, and we need everyone's help in doing so. So these are the words, this is the theme: comprehensive, continuous, integrated system of care. So the critical question we're asking ourselves, and we're asking you to ask yourself, is this: is our system designed to inspire hope for people with complex needs? I'm going to say it again. Is our system designed to inspire hope for people with complex needs? We know that we're here as a Judicial Commission on Mental Health in part because the answer is no. We know that people who experience mental health and substance use disorder, and that's what we mean first and foremost in this context of co-occurring, those individuals have the poorest outcomes in any domain we could possibly name. Despite this, we've designed and funded and regulated a system as if people only have one condition at a time. But what we really know is that co-occurring is the expectation and not an exception. And so what we're asking to do, and to ask you to partner with this, is on significant system redesign that's possible when we come together. And we've got a plan. We've brought this team in called Zia Partners. They're leading the nation in transforming states in this way. And what they have for us to design is a quality improvement partnership that's going to map out this system of change. It's going to help us think about how we change the way we do business and how we become part of the hope business. And so the metric, the question that we ask ourselves when we ask, are we in the hope business, is this: after meeting with us, after a client or participant has met with us, do they have more hope than they did before they met us? That's the metric, right? And when they have more hope, we know that we have embraced their complexity. We've embraced their co-occurringness. And so that's vague, right? That's high level, but there's very concrete changes that we can make that don't even require policy. We will certainly talk policy in the future, but we're going to ask every partner to think about things like this. What is your process of welcoming someone when they arrive at your place of service? Are they seen as being embraced, or are they seen as being something different that doesn't quite fit in? So welcoming and access is first. And then routine screening and identification. One of our other earlier mistakes is that we don't identify these people in our data sets. We don't see them clearly and name them in our analyses, and we need to change that to understand prevalence. And then we're going to start to learn how we do staged, matched, integrated interventions, which means we're going to address all of the conditions at the same time. Someone may be in an early stage of change for one issue, in a later stage of change for another. We're going to do it all at the same time because people do not really have primary and secondary issues. They have co-occurring experiences. And then we're going to build a workforce that's competent and understands and embrace this value. I think we do theoretically embrace this value, but we're going to train a new generation of workforce to implement this value. And so my call to action is to say more to come. We're going to have regional convenings where we talk about this. We're going to bring folks that are historically on the mental health side and help them see their role on the SUD side, and likewise the folks that are historically on the SUD side, and bring them together. But we need our infrastructure, our judicial commission, to be part of that. And so that's my big ask, is that as you see our co-occurring campaign roll out, that you join us with that. And with that, I will turn it over to Dr. Sussman to talk about some of the other awesome work that's happening.
Good afternoon. It's great to be here with you. It's indeed my honor to work alongside Commissioner Marks as an executive advisor for clinical services in her office. I'm a clinical psychologist by training, and I had the good fortune to start my career in one of our state hospitals. And so I thought I was going to stay there a year or two and then go into private practice, but I ended up staying almost 25 years and was able to provide care to some of our really most fragile population of individuals with very complex needs revolving around severe mental illness and substance use disorders. And I actually came to learn in that setting that complex and co-occurring was the norm. And so I have often been surprised to find people who didn't see it that way. So I think this will be a great advance for us to bring to our system that message that we should anticipate that everyone has complex needs, and we have to meet them where they are, and we have to provide, above all else, that sense of hope to them. So I wanted to highlight just a couple of success stories that have involved an extensive collaboration with the judicial system, and then point out a couple of current and future projects that we're working on that you may not know as much about. But I wanted to start for a moment with assisted outpatient treatment, or AOT, also known in Kentucky as Thames Law. And this, as I think most of you are familiar, it's a civil court commitment. So it allows a person with serious mental illness who has repeated non-adherence. They have difficulty engaging in treatment, and they get caught in that revolving door of going in and out of hospitals or into jails or to being unhoused. And so this targets those individuals to put them under a 360-day court commitment with judicial supervision, where they can also have comprehensive services provided through our community mental health center teams. And the history of this is pretty interesting. It was signed into Kentucky's law in 2017. At that point in time, it was unfunded. But our department was able to acquire a SAMHSA federal pilot grant in 2020, which ran for 4 years and gave us $4 million to begin to develop the infrastructure and to prove the concept. And this was very successful, and I'll show you some data from that project in just a second. But we knew that that money was time limited. And so as that grant was nearing its end, we were able to secure a small amount of state general funding to begin to expand the concept beyond just the pilot areas in the grant project. And so that has also now been underway for a couple of years. And we have had luck with getting increased state funding, and we're at a level now for the coming fiscal year that we have $3 million to devote to AOT, which is a really good allocation of money. And we've used that money in a couple of different ways. Our department now has a full-time AOT program administrator to coordinate the further statewide expansion. I've been assigned from the commissioner's office also as the lead to help work on the project, along with many, many, many other people. And we've even gone the step further of developing where each of our community mental health centers now has an AOT program coordinator. And so we're working really hard to get this program pushed out throughout the state. You have, oops, went too far. You have in your packet these slides, if you can't see the numbers, but this is the snapshot from our federal grant, which ran for 4 years, and it showed us two things. It showed us first that people who participate in AOT have a better quality of life. And so you can see on the left side that we had about 90% of the people who went through the program said, I feel more capable of handling daily life. And about 87% said, hey, I feel like I'm getting along better with my family. So those were compelling findings. And then the rest of the findings that you see here show the reduction in many adverse events. And so you see these really large numbers, but large reductions in homelessness, hospitalizations, detox, jail, emergency room visits, and arrests. And yes, this was a small sample, but it really more than amply proved the concept. And we are not the first state to have AOT. There are 48 states that have it. It started in New York with Kendra's Law. But this really showed us that here locally in Kentucky, we can see the same benefits from AOT. So we've been hard at work in terms of developing more AOT capacity across the state in cooperation with our district court judges and with the judicial system and with AOC and with many of you here in this room. And I'm happy to report that we have 17 counties now that have AOT capacity, which is about actually double of where we were with the grant, which was just a little bit over a year and a half ago. And it's also interesting that these 17 counties get us to about 45% of the state's population because we've knocked out a lot of the largest counties first. And we have 4 or 5 more counties getting ready to come online, which is going to take us across the 50% threshold, which has been a very tangible goal. We'd like to see that number up to 75% within another year or so. And then we'll be down to some of the really smaller counties to bring us up to 100%. But that's our goal, and we're working hard on that. And we've had incredible cooperation and participation from district court judges all over the state, and from county attorneys, and from public defenders, and from the clerks in all of the offices of the courts, and from all of our partners here. And I think this has been just a very compelling demonstration of how, when we work together, we are stronger. And so AOT will soon be available in every county in the state, which has been a goal that many of us have had for quite a few years now. We did one more recent analysis, and this is also good to know. We pulled a sample of individuals who had been in AOT who are on Medicaid, and we said, well, what can we find out about Medicaid utilization and cost savings? And so this is relatively new data, but again, very compelling. And you'll see here that healthcare utilization, you can see on the left, dropped almost 40% during AOT and continued to drop to up to 48% after AOT. Monthly Medicaid costs decreased 66% during AOT and 55% even after participation in the program. Monthly hospitalizations declined by 53% during and 67% after. And for those of you who like dollars, we found that the average Medicaid savings was over $1,300 per month per person during AOT participation, and remained at over $1,100 per month savings per person after AOT participation. This is what we call return on investment. And so this program is not only effective, and it's not only changing people's lives and interrupting the revolving door, but it is also saving money. Have to talk about Seth's Law for just a minute. This was your first piece of legislation that the Judicial Commission got passed last year, so you know well about this. And this came about from extensive work. Have to give a shout out to Dr. Colleen Slusher here from our Kentucky Correctional Psychiatric Center, from your competency work group, from many, many other partners who were able to get this bill across the finish line last year. But I just wanted to highlight it because it made a relatively simple but fundamental change in how we approach competency to stand trial evaluations, because it changed the default process from an inpatient evaluation to an outpatient evaluation. And then someone only has to go into an inpatient setting if the evaluation can't be done on an outpatient basis. And what we're finding is that many of these evaluations can easily and capably be done on an outpatient basis. What we're also seeing is one really tangible benefit, and I'm sure Dr. Slusher could give you the exact number, but before all this started, the waiting list for KCPC was well over 400 individuals. And in recent months, it's been well under 100. And I don't know, Dr. Slusher, what's the number today? 69. So that's a dramatic increase. We have also taken time to develop and implement a statewide training program for all of our clinicians and evaluators who conduct these evaluations under 504. And so all of them just went through a comprehensive training program to standardize the processes and to hopefully continue to improve the quality and efficiency of these evaluations. So Seth's Law, pat yourselves all on the back, has been a tremendous success. I will end with a couple of bonus features, if you want to call it that. Some things we're working on that you will definitely be hearing more about. Commissioner Marks mentioned our ACT teams, which are in all of our community mental health centers. These are teams that are designed to provide intensive services to those individuals with some of the most serious mental illnesses, and it provides outreach to them in a very comprehensive team kind of setting. We're now developing a model which is known nationally as FACT, which is a forensic assertive community treatment team model. And this takes an ACT team and it morphs it into a more structured team which specifically targets and provides enhanced services to those individuals who qualify for ACT, who have a serious mental illness, but who also are involved in the justice system. And this has been shown nationally to reduce incarceration, arrests, a number of other indicators. So we have a small grant and we've just kicked off some training. We're going to have 3 of our mental health centers as pilot sites to develop these FACT teams, and hopefully that model will then become pervasive throughout our system. So more to come on that. Our department also is responsible for coordinating and helping to develop crisis intervention team training, which has been around for well over 20 years. It's training for law enforcement. And we have an opportunity now to begin to update and enhance that curriculum over the next year or so. And so we have a team at work on that and trying to bring more current information to that curriculum, things like AOT, things like the FACT approach. And so we're working on those curriculum updates. We also decided we wanted, as a department, to put together a working group looking at mental health services in our county jails. And so that group has been meeting for several months now. We're trying to get a better understanding and assessment of the sort of state of affairs of mental health services in county jails, which really vary quite widely in terms of access and quality. And then we hope to be able to come back and offer some more tangible recommendations to see what improvements can be made in those settings. And then finally, and this will be of interest to many of you because I know we have upcoming the 202A virtual forum meetings that will be happening around the state. But we're taking a look at alternative transportation models within the civil commitment process. And we've been reaching out to some of our other sister states in the region who have decided to privatize some of the 202A transportation through contracts with private transportation vendors. We've talked, as an example, with the Commonwealth of Virginia, and they found that this model is actually very viable, particularly in some of their rural areas. And so we're starting to put together some proposals for further consideration to see if that's something that we could at least try on a pilot basis here in Kentucky. It wouldn't replace law enforcement transportation, but it would be a supplement, and it would certainly relieve some of the burden of transportation from our law enforcement partners. So we have another work group looking at that. I will let the commissioner say a couple concluding remarks.
Thank you. In our work, this is what we believe. People are the intervention. It's the people who are the intervention, and therefore our infrastructure is contingent upon partnerships and relationships. That's why the Judicial Commission is so important to us, is because that's what it's all built upon. And we don't just want to partner, we want to integrate. We want to be seamless with the work that you're doing. And so that's our offer and our ask today. We bring expertise in what evidence-based practice looks like. We can bring subject matter experts to you, but what we really want to do is work with communities to help identify the solutions and opportunities that are unique to that landscape. We know we can't build a single model and reach every Kentuckian. We love the hard work, the complex work. We welcome it. And so thank you for the time today. I hope that you heard something new. I hope you heard something you had heard before. That means we're getting the message out, and we're happy to take a few minutes for questions. Secretary Friedlander.
He's got
Mike.
for the presentation. Oh, sorry. Thank you for the presentation. One thing I want to make really clear, though, 2 things. One, the work of this commission has been fantastic, right? And working with us and working with Dr. Slusher and all the things that we've been through in terms of figuring out how to make things better. But I really the AOT presentation would not have happened without Judge Burke. And I just want to thank you for that. Your dogged determination really and advocacy made a huge difference.
Did I see the slide correctly that said there's been almost a 10% decrease in overdose deaths since last year?
There's been a 30% decrease
30%.
in overdose deaths. The nation is decreasing, but Kentucky's decreasing more, and we've been decreasing faster over the last 3 years. Yes,
Fantastic. Yeah.
absolutely.
We got to be doing something right.
We're doing a lot of things right, and we're going to have to keep all of those things up to see continued progress.
Good
Yes.
job. Ms. Luttrell.
Is it okay to use this mic? So I loved seeing those outcomes over time for Kentucky. And I'm always interested in how Kentucky stacks up in some of these respects with other states. And our position has bound to have improved significantly. Is that something that you all are already looking at? And could you share that with us at some point?
Are we speaking specifically on overdose deaths?
No,
Or-
the other outcomes
Oh.
as a result of AOT and Tim's Law, all of those really.
There's a fair amount of research from other states that we have reviewed. And the Treatment Advocacy Center, which is a organization that really promotes AOT nationally, has pulled together already a lot of great summary reports and information. And we could easily get some links sent out for you to be able to see that.
I just think it's a good gauge of, it's great to improve over time, but how is what we're doing producing the outcomes compared with the outcomes other states are doing is very meaningful and may lead us to other additional changes that we'd like to make.
Anyone else? Thank you, Commissioner, Doctor. Appreciate your presentation.
Thank you.
Keep up the good work. Next on the agenda is committee and work group updates. In your materials, you'll find the quarterly reports for all work groups. Additionally, you'll find updated commission structure for your binder. And up first, we welcome Amy Luttrell as the chair of the Treatment and Access Committee.
Thank you. I was just thinking as I looked at the notes and think about some of these activities that I really do think that the strength of these work groups that we have under each of our committees is the chairs that we have. As I sit in on as many of those meetings as I can, I'm just always impressed by the enthusiasm and the passion that those work group chairs bring to their task because they are in positions usually to see the effects of what we have been doing and changes that we make. So I really appreciate the work of all our committee chairs and especially want to welcome our two new work group chairs, that is, who are Dr. Lindsay Jasinski and Dr. Mark Woods. Dr. Jasinski is the Chief Administrative Officer for Eastern State Hospital and Dr. Woods, the Chief Nursing Hospital of Eastern State. And we have just had our first meeting recently with those new chairs installed, which was very exciting. All of our work groups are looking at their work plans and reevaluating their priorities as kind of an annual task, which I think is going to lead us to some different directions in some cases, and in other cases, continuing the directions that have already been being successful. So I think with that, I'm going to go ahead and ask our work group leads to report, and then if there are any other things, I can make remarks at the end. But I have to say that our work group chairs are really educating me because in every case, really, they know a lot more about their subject matter than I do. So I really appreciate their leadership and the time they're putting into this. So Dr. Jasinski and Dr. Woods, I think we have both of them with us, and I don't know which one of you is going to take the lead. Thank you.
Unavailable, so I do apologize for that. You'll have to put up with me for the time being. As Amy suggested, it's a really exciting time for us. We took this committee over, and one of the first things we wanted to do is basically review all of the different or the most recent sort of like priorities for our group. So one of the first things that we've done, had our first meeting recently, and have now sent out a survey to all of our members to try to prioritize. We had a very lengthy list of things that we wanted to do. We were very ambitious. But we think to be effective, we need to really hone that down a little bit. And so we've done that, and we're in the process of sort of reevaluating and trying to prioritize all of those things. We're still in the process, though, of creating the virtual training. I think on MOUD, that was something that was started previously, and I think we're in the process of finishing that up. And then the last thing for our group was to review the pre-arrest and diversions jail survey for feedback. And so we were trying to incorporate that also into our prioritization of the things that we want to accomplish. And so I wish I had more of a substantial report to give you, but we just kicked off our first one, and we're super excited to be here. I do want to make one comment about our overall this group. I've been a part of this since its inception, and I feel blessed and absolutely honored because I've been able to see the growth of this group. It seems like we just continue to get better. All of the things that kind of come out of this just leaves me absolutely inspired about the future. So super excited to be here.
Thank you, Dr. Woods, and I don't think any apology is necessary. I think you and Dr. Jasinski jumped in with both feet and had a very strong start to the next phase of this work group's work. And for everybody's benefit, I don't think I mentioned this is the Strengthening Communities work group. So next we have Crystal Adams to report for the Intellectual and Developmental Disabilities work group. Crystal?
Good afternoon. Sorry that I was unable to join you all in person today, but I'm pleased to be able to provide our report. Our group has met specifically one time during this quarter due to some holiday and other conflicts. However, we generally do meet on a monthly basis, and that is our overall goal. This quarter, we received updates on our legislative package, Senate Bill 26. It was signed into law by the governor and will take effect, as was mentioned earlier, on June 27th, 2025. At our next meeting, our group is going to continue to have discussion on the next steps and strategies for implementation and how we can support the cabinet in that implementation. We have continued our work in regards to training, and we are so pleased that our first two trainings were finally completely final, are published, are currently available for folks to complete that training. And so we're very excited about that. We have continued to do work on additional trainings. Our autism work group has materials that are under review and revision for two specific trainings that we hope to be able to finalize in the near future, and several additional trainings that we have in the pipeline. We also are currently finalizing a training on KRS 202B, which is for involuntary admission of individuals with intellectual disability. And we also plan to provide that training and information as a presentation on one of our future work group meetings. Our work group has additionally received a presentation from the Division of Motor Vehicle Licensing on the Deaf, Hard of Hearing Communication Program, which allows individuals to add a communication disorder designation to their vehicle registration through their local county clerk's office. This presentation informed the group's ongoing discussion around best practices for self-identification models, which continues to be one of the focuses of this work group for recommendations in the future. For anyone who may not have already been able to get this, we do have copies available. The Center for Accessible Living has made copies available of the book, A Celebration of Family, Stories of Parents with Disabilities. If you do not have one and you are interested in one, Heather can get those for you. And I believe Heather was going to be holding her hand up to let you know if you're not sure where Heather is to go retrieve that. It's a wonderful book and a great celebration of some of the work that we were able to achieve with Senate Bill 26. And we look forward to continuing that work and our work on trainings and other topics as it comes up in the future. Thank you.
And even though this work group might have met only once, there is always a lot of work that is ongoing between the work group meetings. So however often or seldom they meet, this is a very busy work group and very productive. Thank you, Crystal. And then finally, I'll ask Judge Stephanie Burke to report on behalf of our court responses work group. Judge Burke.
Thank you. You'd be surprised to know that my work group discusses AOT quite a bit. The Court Responses Work Group has met 3 times in the last quarter. In March, we were very happy to receive a presentation from Dr. Sussman and Tara Brewer, who is the statewide coordinator for AOT, providing us with the data that you just received that was released by the University of Kentucky that month. That was the first time that I saw that data, and obviously, as you can imagine, am very, very pleased and happy to see how well, not just how well my program is doing in Jefferson County, but how well the other programs and how fast we have expanded. It's really remarkable how quickly Kentucky has rolled out AOT to such a significant portion of our citizens in such a very short period of time. To get the funding and then to get the general fund funding from the legislature in such a quick period of time is really remarkable. And working closely with the Treatment Advocacy Center, they have recognized that. Dr. Sussman and I and many others attended their conference in March, and they have made it very clear that we have done this very, very well. So, and they have recognized that going forward, they would like to use our model for other states other jurisdictions who are in the early stages of their programs. So we were working with some of those states now. So also our work group has discussed some of the issues. We would like to develop some more materials and educational programs for court personnel and judges with respect to dealing with the seriously mentally ill adults and individuals coming before us. We've talked about bench cards, other educational resources and websites and things that are already available that we could have access to, but creating easier access to judges on the bench and other courtroom personnel. We have also discussed barriers to driver's license reinstatement. This is something we had a presentation on in the last quarter, but we've continued to discuss this. Currently, there are discussions about how persons who have been in guardianship court can go back to court and seek reinstatement of driver's license privileges. However, if you have been found incompetent in a criminal action, there is no remedy to get your license reinstated. And that is something that is a serious concern and needs to be addressed. One, I think, by this commission, but more importantly, by the General Assembly. There needs to be, we know that mental illness and mental health is fluid, and it should not be a lifetime sentence to never be able to drive. People do get well, they do become capable of driving, and we need to be able to provide that access to those individuals. I know that we have people come in front of us regularly in front of the court and ask for us to sign orders to get their license, and there's no way to do that but to have their criminal charges reinstated. Clearly, that's not a feasible option, and we just basically tell them there's nothing we can do. That's not a good answer. So we've talked about that a lot in our work group, and that is something we want to study going forward. We also have discussed at length implementation of Seth's Law and how that's going. Specifically, we have had some breakout groups with meetings from other work groups, particularly about the AOC forms and how we can make that process more streamlined. Clearly, the implementation has shortened the wait time by a lot. Obviously, that is going well, but there are still some kinks that we would like to see worked out, and we are working on that with the other work groups. We are also have talked at length about modernizing some language in 202A. I think that there has been quite a lot of chat among members of the legislature that they are discussing 202A, and we want to be on the forefront of that, especially as a commission. If there are going to be recommendations, we would like those to come from us. And so that is something we have talked about at length. So we have been very busy. We're obviously looking forward to the next legislative session, and that has been our priority.
Thank you, Judge Burke, and congratulations for your role in some of the changes that we've already heard about today and improved outcomes that we're seeing here in Kentucky. Do any commission members have questions for any of the work group chairs? All right, thank you.
Thank you, Amy, Judge Burke, Crystal, and Dr. Woods. Up next, we have Judge Cutoff for the Civil and Family Justice Committee. There he
Thank you,
is.
Justice Conley. I'm coming to you live from Hopkinsville from my chambers. I had court this morning, so I could not make it in person, but I appreciate everybody being there to have these discussions. The Civil and Family Justice Committee had their quarterly meeting on May the 30th, and Vice Chairman Chris Griffith, who I believe is in the room, he chaired that meeting that day. And the work group people gave their updates. Our work groups involve domestic violence, dependency, neglect, and abuse, and guardianship and commitment issues. Those work groups remain focused on advancing their work plan priorities, and their key areas include creating training materials for court personnel on best practices for us to use, finalizing the bench card on withdrawing domestic violence protective orders, which you can find in your meeting materials. And I think that's a great tool that Judge Brown's group has come up with. Exploring existing programs to enhance access to resources, and reviewing AOC's forms to enhance our court processes here in the Commonwealth of Kentucky. I would like to echo the last committee chairperson by saying that our work group chair people do fantastic work. They meet a lot, and I don't make all the meetings, but I get the emails, so I do know that they're working very hard, and I look forward to hearing their reports today. Before I call on Judge Brown, I will say that Stacy Tapke was unable to join us today. She's the guardianship and commitment. There's two different work groups. She chairs them both. She was unable to be here, but she does have a report, and that report will be found in your materials that you have in front of you. So you can read that on your own time. So Judge Brown from Jefferson County is our domestic violence work group leader. And Judge Brown, please take it away.
Thank you. Thank you. We have met 2 times in the last quarter, and we have been very busy working on the first of many bench cards that will be distributed to judges in the coming year. And you have a copy of the request to dismiss or terminate protective orders. And I believe that we selected that one because we were getting a lot of feedback from the community and others about whether people really understood what would happen after they made a request to have a dismissal. I mean, there's a lot of shame associated with even coming to court and asking for this kind of help. And sometimes people just didn't realize that if you don't have a hearing, you can refile that same information. And since we all know that the first time that a person leaves is not usually the most successful time, they may have to come back a couple of times or try to leave the situation on more than one occasion. We wanted people to know that you don't always need to have new events and new activities. If you ask for a dismissal, you can come back and use that. And then also, just to make sure they're aware that just because you ask for a dismissal, that doesn't prejudice you when you have to come back and file again. So we believe that these questions that we have for judges to consider and to ask and inquire of the victims as to whether they are aware of the resources that are available to them, are they aware of the processes, and really thinking about the lethality factor. I can tell you my experience has been that so many persons really minimize what happens when they get strangled. And they don't really realize how close they are to death when something like that happens. And so we made that one of the questions that we want judges to make sure that they are going over this information with people so that they have the resources and can make those choices. Now, these bench cards will be available on the Mental Health Commission website, as well as they're going to be distributed to the judges at each of the colleges that we will have this year. And then the second document that we are very proud of is the domestic violence awareness poster. And this is going to be displayed in all of our courthouses. And I believe the clerks, yes, they already have them. So they have 3 QR codes that provide a lot of resources. So a person doesn't have to grab a piece of paper or go to a website. They can simply use their phone to get to that information. And we are very proud to have these around. And if anybody needs more, let us know. We'll be happy to distribute those to you. Now, the distribution and the cost associated with that came from a grant that was with the Violence Against Women Act and from the specialty courts. So we appreciate the help that they provided to us to make sure that that happened. Now, 2 of the other committees that we have are domestic violence advocacy in schools. And that is basically making sure that our youth are aware of how to build healthy relationships. We have seen an uptick in the number of protective orders that are being requested by parents for their children. And we're taking a look at the Texas 4R program to see how we can incorporate that into things that we're already doing here in Kentucky. It is scheduled to be featured, our efforts to be featured on the Kentucky Superintendent's webcast, but that's coming up in July, so we'll have more information for you on that a little later. And then we also have the multidisciplinary teams and resource access group. And that's basically making sure that we're pulling together all of the resources, trying to get them in one location so that folks can kind of one-stop shop to find out the information that they need. So our hope is to have a printed brochure. But you know, with a printed brochure, it always gets outdated fairly quickly. So we're still looking for other options to get this information online. In the meantime, we're have a database of resources that we make available to everyone to be able to access that information on a more updated basis. And that's going to be all that's all I have for today.
Thank
Any
you, Judge
questions?
Brown. Does anybody have questions for Judge Brown?
I don't have questions, but they also. Sorry. Tanya Terry, Circuit Clerk in Montgomery County. I'm the president of the Circuit Clerks Association. Along with the domestic violence awareness poster, they also gave us at our college one in Spanish also. So we have both of them that's posted. Especially, of course, put it in the bathroom so people could stand in the cold in privacy.
Okay, so they are located in the restrooms, multiple places throughout the building so that people can scan it in privacy. And that's really important as well. And glad to hear that we do have it in more than one language.
Fun of that. Anybody else have questions for Judge Brown? Judge Brown, I will say, I missed the committee meeting on May 30th because I was assigned a special domestic violence case in Muhlenberg County, and they don't have a family court, so their district judges handle their EPO situations, whereas we have family court, so I don't do these on a constant basis. But it was a case where the petitioner requested dismissal, and I had printed out your bench card that Justice Conley had emailed us earlier in the month. So I used that day, and it was very, very helpful. So I appreciate that. Thank you. Our next work group will be the Dependency, Neglect, and Abuse Work Group. That is chaired by Judge Marcus Vanover. He is also on Zoom. Judge Vanover.
Thank you. So the Dependency, Neglect, and Abuse Work Group has met twice since the last commission meeting. Our first meeting was on May 13th, where we discussed our priority areas. We have one group that's working on enhancing collaboration and communication with system partners. That priority area is moving forward with their Relationships Matter Part 2 training series. Those trainings will be released in August, occurring monthly through December or January. We have started with some of the recordings. The trainings will be recorded as webinars, and the speakers will be available during the presentations to answer questions. The sessions are professionalism and respect, promoting resilience, power of positive childhood experiences, increasing understanding of medications for opioid use disorder, and intellectual disabilities in high acuity youth. So we also have another priority area that we're working on, our bench cards for understanding the mental health providers and assessments. That bench card has undergone review through AOC's legal department, is now back with the priority area work group so that we can finalize those edits and then get it on to formatting for printing. That we hope to have these distributed before, but definitely so that we can hand these out to the judges at our judicial colleges this fall. Let's see. Our best practices guide also has been reviewed by AOC Legal. We're waiting. They have several comments to come back. Because of the size of the document, there were more editing that needed to take place with this one, so we're taking a little bit longer. But we're still working in the editing phase and hope to have that out by the end of the year. Let's see. Finally, we have been working on enhancing training for court-appointed counsel. That priority area has had 2 groups of trainings, one in the fall of 24, and we just had one that completed from May 16th in London, May 23rd in Hopkinsville, and June 16th in Frankfurt. Those trainings have been finished, and we are reviewing the evaluations. It's a constant process with these trainings that once the 3 trainings are done, we're taking a look at the evaluations that we do to see how we can improve upon those and make sure we're keeping them fresh and current with developments in mental health and in regard to the law on dependency, neglect, and abuse trainings. Our other meeting, let's see. On that May 13th meeting, we also invited several legislators to start the ball rolling on our discussions for recommendations that we were going to make to the executive committee for presentation. We had a follow-up meeting after that on May 22nd to discuss the matter further. So our work group has been asked by the Kentucky Youth Advocates and the Judicial Engagement Group to kind of work with them and work with the legislature on improving the guardian ad litem process. This is a fairly large undertaking, and frankly, it's still well within the developmental phase and couldn't be presented kind of in a concrete manner to the executive committee for approval. However, the discussions did indicate that we would continue to work with Kentucky Youth Advocates and legislative committees that are already looking into this, and hopefully that we can have a voice at the table to work with those groups as they advance their ideas of reforming this process, and we can have an idea of how that's going to work. We have met with individuals involved in the reformation of the process in Oklahoma and gotten a lot of information from them about how they undertook those revision efforts. And that seems to be kind of the model that is being looked at most heavily by our group and by Kentucky Youth Advocates, and hopefully by the legislature when they're looking to move things forward. But again, we're hoping that we can have a voice at the table and participate in those discussions as they move forward, and that we can kind of communicate with the commission so that we're making sure that we do the best we can in those discussions. The next meeting that we will have is August 19th. so that we can have an update on all of our priority areas and report those out at the next meeting. That's all I have. Thank you.
Thank you, Judge Vanover. Does anybody have questions for Judge Vanover regarding the dependency, neglect, and abuse work group? All right, you did a great job, Marcus. Nobody wants to ask you anything. That's good.
That's good. That's always a win. Thank you
That
all.
is good. All right, Justice Conley, that concludes the reports from the Civil and Family Justice Committee. Thank you.
Thank you, Judge Cutoff. It looks like it's sunny there in Hoptown. I'm envious.
It is now. It was raining all morning, so it's getting better. So
Good. That means it's coming our way.
I hope so.
Thank you, Judge Brown, Judge Vanover, for your updates as well. Lastly, we have Criminal Justice Committee provided by Judge Mayer.
All right, good afternoon, everybody. I like following up after Judge Cutoff because normally I can just say he took mine. But in this particular instance, I'll be required to give some specific updates. Before we do that, the thing I have to say, which other committee chairs have said, but I really want to bring it to bear with this group of folks we work on. Our updates come at the end. It's a Friday afternoon and folks are tired and you have worked a hard week and I respect your time. So I'll try not to waste it right now. But we do have some folks here who have been leading their work groups since this commission was started. Dr. Slusher, Judge Jones, when you hear from them in a moment, some of you are at your first commission quarterly meeting, and you might not have the context right now to understand what incredible work they've done. But those two leaders, along with our other leaders, bring not just an incredible amount of professional experience, but every time we meet, they bring their work ethic. It's so easy for all of us to be members of the Judicial Mental Health Commission. It's a real challenge for us to bring our skills and our insights and apply them regularly. And I'm in deep admiration for our work group leads when they step up. And you'll see here in a moment when I give you a little insight what kind of work they've already done and where I think this whole Mental Health Commission is going on the backs of some of the work that these work groups have done. So the first thing is, we're actively working on work groups and plans and development. I think all of the work groups are doing that. Our key priorities at the moment are developing certain educational materials, analyzing existing programs. We regularly have experts come. We have a lot of expertise in these work groups. There's always a subject matter expert who can refine something for us. And we've had a lot of people come and meet with the work groups. We're working on proposed legislation. Amongst the things I wanted to point out before I briefly talk about the pre-arrest diversion and the reentry before throwing it to Dr. Slusher and Judge Jones. We heard earlier today from Dr. Sussman in his PowerPoint. At the end, I think you referred to them as bonus features on page 7, kind of toward the end of the slides. You'll see there are a few things that have been really important to these work groups for a long time. The crisis intervention training, mental health services work group for the jail. So I'm not saying that we're leading on this, but it feels good to know that we're leading some work in these work groups, and we have similar subject matter experts and, an entire branch of government that's doing the same. In addition to that, when we did the work group updates for the Strengthening Communities work group, Dr. Woods mentioned that amongst the things they're waiting on is the jail survey. And the jail survey's been a long time coming, but some things are worth doing well as opposed to doing quickly. And so it's taken some time, but I think a lot of these work groups and a lot of our justice colleagues are going to benefit from the information that's in there. And I'm proud of everybody's commitment to seeing it through when it's been a long process. So Steve Shannon is our pre-arrest and diversion work group lead. He is not able to be here this afternoon. He was here. You probably saw his name on screen for a while. You'll see the update for that group in the binder, but I'll just point you to that amongst the things that group is working on is crisis intervention curriculum, some more presentations on that, talking about our Senate Bill 90 behavioral health conditional dismissal program and how it's working across the state. And then also the big thing is working on the jail survey and the police social worker white paper. And I think you all are going to find those things very informative and very interesting. Erica Hargis is not able to be with us this afternoon due to another commitment. You'll see that group has been meeting pretty regularly. And they're kind of catching up because it's the last work group that's been added to the Criminal Justice Committee. they're working and waiting on some information from the jail survey. There's a lot of education going on with that work group right now. What I would say is for those of you who are thinking like, I want to work with a group that has some hope to it, that has some optimism, that has some changes that seem realistic and doable and not always the thing that's months or years out. This reentry group is really focusing on those things that can change people's lives in dramatic ways with small changes. Things like licensing, like Judge Burdick was mentioning, other things like that. So if you've got folks that are committed to those ideas, reentry work group is another great place where we would love to have them. Proud of the work they are all doing. And now we will let Dr. Slusher give the update of the competency group. Thank you.
Hello, everyone. All right. Well, I want to start off by saying I misspoke on the wait list earlier. It's 59. So we want credit for every bit of it, my staff. So 43 of those individuals are in jails across the state and 16 of them are on bond. So when we talk about future, we talk about community-based programming expansion, it includes potentially some community-based restoration for people who are out and living well in the community. KCPC receives about 25 orders each week right now. We have a slight increase, and so our wait time for outpatient has gone up, but we anticipate that's temporary as we kind of sort through people being off work and that sort of thing. But just so you know, we are constantly trying to bring it back down to 4 to 6 weeks. The work group continues to meet regularly. This quarter, we only met twice because of a scheduling issue, but we have been able to focus on the AOC forms. Judge Burke mentioned some of that work that's happening and providing education where we can about how those forms should work and provide seamless service delivery, whether evaluation or inpatient service for individuals moving through the program. And we have talked about strategies to promote more education and awareness where that's needed on forms and CES law implementation, including potentially a statewide webinar and developing a legislative response package to CES law. So we also continue to work on, you all have heard us talk about the council and state government who served as our TA advisor for our work group, and they developed 3 products. We are trying to work on finalizing one of those that we can distribute that we think will be a really helpful reflection of the work across about, 15 or 16 months with their assistance. We had a presentation on the jail-based program that we started about 18 months ago. It's formally been in place for right at a year through Yes Care in that particular facility. That program, as a reminder, serves Central State misdemeanor cases and KCPC felony cases. And we have a KCPC psychiatrist who serves as the treating physician in that program so that we are replicating service delivery where that's important. We are beginning a new Fayette County Detention Center jail-based program this summer. Probably, we said July, we're a little delayed. Probably in August, I'll be sending out correspondence statewide on Monday. That will serve Eastern State misdemeanor cases and KCPC felony cases. This system expansion further allows inpatient beds to be used where they are needed the most, whether on the civil side or the forensic side. So we're very proud of this work. Wanted to touch on really quickly, Dr. Sussman mentioned the FACT grant, the Forensic Assertive Community Treatment Grant. We had our kickoff this week. He mentioned we have 3 CMHC partners in that grant work. It's around creating a implementation team for what we could bring to the state for Forensic Act services to serve really kind of an array of individuals who intersect with behavioral health and criminal justice. And we are also have Louisville Metro Department of Corrections as part of one of our partners in that grant. And the reason for that is to help people flow through the system. If they've been in competency restoration, then they're moving out into the community. They could potentially be connected with FACT to make sure everyone is having all their needs met in the community and hopefully not being arrested again and back in the criminal justice system. And I think that is it, unless you have questions for me. All right, thank you.
All right, thank you, Dr. Slusher. That takes us to Judge Jones.
I think I'm the last committee report standing between everyone and their Friday afternoon, so I will try and make this quick. First off, I do want to echo what Justice Conley said as we began, that how inspiring it is to hear what all the work groups are doing and what all has been accomplished. And I just want to thank AOC again for all that you all do to help us prepare and keep this moving forward. The Juvenile Justice Work Group received an update from Department of Juvenile Justice Commissioner Randy White. So thank you all very much. He reported on current initiatives and developments within DJJ, and we look forward and hope that he will continue to provide us with updates so that we can collaborate and work on priorities and additions to our work plan. We also have two subgroups. Our legislative priorities subgroup heard a presentation from AOC's Nathan Goins on the history of the presumption of criminal responsibility in the infancy defense. And the work group also invited county attorneys from across the state to come and speak to us about their ideas, whether in support of or opposition to some of the ideas that we've tossed around as a committee, especially around the ideas of juvenile competency and ages of competency. And we took their recommendations to heart and hope that as we develop legislation that we can try and tailor that to meet everyone's concerns and meet everyone's needs, as difficult of a challenge as that may be. We also have a mapping priorities subgroup, and that group received a presentation on the Wanda Joyce Robinson Foundation, which supports children and families impacted by incarceration. The presentation was shared with the larger work group when we met. Additionally, the subgroup heard from Department of Juvenile Justice Intervention Services Program, which focuses on interventions for youth at risk or involved with the juvenile justice system across Kentucky. And they're hoping to receive future updates from SEAC's Rapid Response and Crisis Stabilization Work Group. Action items, we're going to continue to work on our legislative initiatives, and we hope that we're actually at the point where we may be putting some things in writing and hopefully be able to present those. And finally, have recommendations for our statewide pro-social efforts and to draft recommendations regarding our improvements for crisis stabilization services for youth in Kentucky. So, thank you all. Any questions?
Thank you, Judge Mayer, Judge Jones, or Dr. Slusher. I almost made you a judge there.
No, need to demote
We have
her.
so many. Yeah, I don't want to demote you. Yeah. Before we adjourn, do we have any comments for the commission members? None? There's one more item in your materials that I want to highlight. You'll see that we've finally published the 2023 annual report. This report was started by Seth Stevens before we tragically lost him. And I can speak for Shauna and her team that it was a difficult and emotional task to pick up and finish the project. But the report is published in honor of Seth, and I'll ask you to take some time to review the impressive work completed by the commission in their first year. It's also available online if you wish to share it. And as a quick reminder, this report summarizes August 2022 through December 2023. Thus, it will not reflect the current membership order. The 2024 report is well underway, and we should have copies for everyone by our next meeting. We'll also be sending details around about the 202A virtual forums by email. You're all invited to participate in those forums. No invitation or registration is needed. Our next meeting will be September 16th here at the AOC. And that will also mark the commission's 3-year anniversary. It's hard to believe, 3 years. Thank you all for being here today, and thank you for all that you do to support the commission. Please travel safely, and please leave your table tents and your name badges so we don't have
We
to.
got Dr. Sessions got his hand raised
Oh,
online.
where? Oh,
Online.
and, oh, I see. Okay. Yes,
Dr. Sessions.
Dr. Session. Hello.
Good afternoon. Good afternoon. Sorry I couldn't be there in person on today, and I'm not going to take too much time. Just want to give one big highlight, and I will send the information out to Shauna, and if it's approved, you all will get it. On September 24th, we're going to have a suicide mortality review, lethal means safety training in Louisville. It's going to be a free event. It's going to be some clinical options and things like that. It's going to be a full day at the Parklands. I will get details, but this is a part of the suicide mortality review grant that we won with the Governor Challenge for that piece. But I will get more information out. But this is a great opportunity for folks who are interested in learning. Firearms is the highest form of death by suicide, and veterans have a higher percentage than non-veterans, but it is open to the public. This is a free event, but more information will come. But again, thank you for your time, and I thank you for all you do. This is a great effort. This commission, everything. I just enjoy it. Just gotta continue to work my schedule like you all do to be a part of more of the work groups. But again, thanks again.
Thank you for giving us that reminder. I'll make sure that it goes out on email so we won't forget it. If you're all like me, I've got to have some kind of reminder. Anything else? Oh, table tents, name badges, leave them here so Shauna doesn't have to redo them.
Thank you.
All about Sean.
See you all in September.